I want to welcome everyone here today as we explore the heartaches and triumphs of our long-term survivors with HIV. June 5th is Long-Term Survivors Awareness Day. On June 5th, 1981, the U.S. Centers for Disease Control and Prevention reported on the first cases of a rare pneumonia affecting young gay men living in New York and California. It would later be identified as HIV/AIDS. We will be holding an exciting and informative conversation about tenacity, heartache, courage, anger, activism, strength, frustration, and so much more on the journey to becoming a long-term survivor. On our panel today, which I will talk about more in a few moments, there is a combined period of approximately 88 years of living with HIV. Before we hear from our panel members, I want to acknowledge and speak just a moment to a couple of issues all of us in one way or another are dealing with in recent days. I want to express my appreciation to the courage and ability to adapt by both people with HIV and those who work in the service delivery system in dealing with this pandemic. As you know, activism, advocacy, and just plain hard work has been a part of the HIV community. Examples such as ACT UP worked tirelessly to bring about recognition and treatment of HIV. Many people participating in this webinar show bravery and willingness to adapt and modify in both the delivery of services as well as in receiving those services. All of you, whether providers or recipients of services, are our heroes. I would be remiss if I did not mention another issue affecting all of us in one way or another. Since the death of Mr. Floyd at the hands of 4 policemen, we have seen many, many people come out of their homes during a pandemic to strongly express this is not right, and we need significant change in how we treat persons who are Black and all persons of color. We have seen this issue far too many times occur across our country. Each time we feel and say the issue must be addressed and resolved while happening again and again. I really hope and think perhaps this time something is different. I hope as a country we embark on a meaningful journey that addresses and makes considerable progress on the issues, including addressing racism. All persons, regardless of their color, age, disability, sexual orientation, gender identification, HIV status, and many others, are addressed and seen for who they are inside and their character. Now I want to turn to our purpose today, which is to hear from 3 outstanding persons who are willing to share with us their personal story and experiences on the road to become a long-term survivor. Each person in our 3-person panel will have an initial 10 minutes to present their story and journey in being a long-term survivor. In the order you were listed in the Achieving Together, meaning it's in the order there is Gary, Glenda, and Stephen. If that's okay, or if anybody else really feels strongly they want to go last or wants to go first, I'm happy to hear that.
I'm happy to go first. Can you hear me?
Yes, I can, Gary, and you can go on. Yes.
Okay. My abject apologies for not being on screen. The program works for me during the trials, but today it won't come up. You're not missing much anyway. I will begin. When I tested positive in 1985, there were no services or treatments for HIV, only fear, government indifference, and the threat of being rounded up and quarantined. Friends were dying all around me, friends far more accomplished in life than I had been. For several years, we had watched in horror as this mysterious illness struck gay men. With every sexual partner, I wondered, is this the one? Will this night of pleasure be the one that kills me? Then when I was 38, I had just relocated back to Texas to begin a new relationship. He tested negative. I encouraged him to back out of our commitment, but he opted to stay together. And that, more than anything, has been the source of my strength and survival. I know I'm one of the lucky ones. Today, we're confronted with overwhelming disruption in our lives. First, the coronavirus pandemic, and now widespread protests of police brutality and government indifference to the structural, systemic inequities in our system, economic and racial. Public health efforts to persuade the public to social distance and wear masks, avoid close contact, are being challenged and defied as a violation of rights. We saw this in the early days of the AIDS crisis as well. Refusal by gay men to stop having sex at bathhouses. Outrage when those bathhouses were closed down. There are probably a lot more parallels. Normally, we just try to live our lives peacefully and mind our own business, but suddenly that's not even possible. This is a time for taking a stand against injustice as we reach the tipping point. The frustration is even greater than our fear of contagion. For me, this has been a source of great frustration, as I feel helpless to take action other than to vote. I'm old, and as a cancer survivor, too weak to take to the streets, and looking at news coverage, pictures of mass turnout, I realized I wouldn't be able to pee. That's a big deal at my age. I think that's why we don't see a lot of old people in demonstrations. They feel like the 1960s civil rights turmoil. I went to jail then for my belief in racial equality, and then the awakening of gay consciousness as we fought back against sexual discrimination after Stonewall. Great progress was made, but as we know now, the problems are much, much deeper than getting reform laws on the books. The pandemic brings back our AIDS struggle against government inaction and indifference in the 1980s. Then a President Reagan who wouldn't even say AIDS, a world that considered it a disease of undesirables, gay people, people of color, but a tipping point had been reached. The political will to effect change had developed, and our collective efforts did lead to change. Just a couple of weeks after I arrived in New York in 1969 to begin my career in book publishing, Stonewall happened right down the street from my apartment. The organizing rallies that followed were an inspiration to me to live with pride in who I am. And then later, when the AIDS crisis overwhelmed us, we used what we had learned in the LGBT rights movement to organize the response to AIDS. We created that response out of nothing, building services to take care of our own sick and dying, demanding publicly the funding to search for treatment solutions. Everything that is happening to our world today conjures a powerful feeling of deja vu. As an AIDS patient with then a T-cell count of 100 and falling, I lived with the fear of imminent death while hiding my status and my sexual orientation and my relationship every day at work. Just when you thought you had a handle on the fear of dying, a harmless purple spot would send you right back into abject terror, which you had to hide in public. I learned early on that the best way to manage that fear and find my own courage was in helping others and taking action. By 1987, we were in St. Louis, where I got involved with the fledgling group Effort for AIDS, serving on the board and as public information manager and facilitator of a support group. During that time, we struggled to take the organization from all volunteer, meeting monthly at a donated Red Cross building room, to a professional AIDS services agency with United Way funding. That progress did not come easily. There were bitter disagreements over strategy, and especially getting buy-in from the Black community in a city with a history of racial injustice. You say you want us to come and be a part of your group, but what you really want is for us to be like you. We aren't like you, they told me when I tried to reason. When news of our winning support from United Way spread in the gay community, I was personally ticketed by ACT UP at a board meeting for giving away all that the gay community had fought for to take control of our health. So you see, emotions were running very high then as they are now. I think I found my courage by helping others find theirs. Taking calls on the hotline, spending time with dying friends, facilitating that support group that one by one lost the battle to survive. I learned to accept that we were dealing with a microbe we couldn't defeat, but that taking a stand to do all I could to stay alive in spite of that was real courage. In 1993, my tests were showing a steep decline, and soon I was hospitalized with a virulent case of pneumonia. My doctor recommended going on disability, which was quickly approved under the more enlightened policies of the Clinton administration. In 1995, we returned to Austin. After a couple of years of improving health, thanks to the new protease inhibitors and drug cocktails, I agreed to serve on the board of AIDS Services of Austin. The focus of the agency then was safe sex education, dental care, providing food bank social services to the neediest of the needy, constrained by the limits of funding. Financial assistance with insurance premiums and HIV medication was a great help to a wider community as well. Soon I found myself working hard as the chair of the development committee. Once again, I was facing fear and dread, asking people to open their wallets. It was really scary, but I learned a lot and found more satisfaction in doing that than I ever did in my marketing and communications career. Today, our AIDS agency in Austin is making great strides into the future of HIV management, moving to the model of full medical and pharmaceutical, as well as supportive services, making treatment more accessible to so many more. Along the way, I learned that it is in the very act of doing something to help others. It is in that moment that we experience grace in life. Help others to find their courage, and you'll find your own courage, and you'll find that life does have meaning. The coping skills that I learned in facing my own AIDS crisis served me well later in life when I was diagnosed with stage 3 prostate cancer and given a grim prognosis, maybe 50% chance of survival. This time I was not overtaken with fear and dread. It was easier to understand that by letting go of the need to control the situation, I could let go of anxiety and just focus on enduring the treatment and staying healthy. It's been 2 years and now the outlook is much brighter for me. And again, the emotional support I received from my husband and friends has made a lot of difference. So here we are, still here, living in seclusion now and frankly liking it. Grateful and lucky beyond my wildest imagination, watching our world once again reach a tipping point in the struggle to deal with injustice and lack of equality. Thank you. And that's it, folks. Are you there?
Yes, thank you. Can you guys hear me?
Yes.
Okay. My name is Glenda Small, and I want to thank you all so much for allowing me to be part of this. It's such a great opportunity to be able to reach out to people that I don't know, I have never seen. And I apologize for not being able to get video, but on my phone I can only get audio. So that's why I'm not able to get a video. You all are not able to see me. But for me, it started back in 1992 is when I was first diagnosed. At that time, there wasn't a lot of medication around to treat people that were diagnosed with HIV. In my journey through that, I found out that, that I saw a lot of people passing away, and I couldn't understand what was going on. Because of the medication that we had at that time, there was only AZT. And so, as being an African-American female and also being, a woman of color, this was, it took a toll on our immune system. So therefore, the medication that we were giving for to fight the infection was actually enhancing other parts of the body, like the kidney, the livers, and other aspects of the body. So therefore, the medicine was not working as they thought it should be, especially when it came to African American people. And the doctor had that time, she tried several different things to try to make sure, that all the patients that she endured were taken care of, and that we were staying healthy as possible. I remember her giving me interferon, and some other medication, which is basically at that time what it was just like treating people for cancer. And this is what her method was at that time, in trying to treat the people that came to her that were HIV positive. And some of it worked, and some of it didn't. Actually, like I said, it's been a long journey, a long struggle. I had to experience the fact that, just the idea that people are dying around us every day, and they're still dying as of today because of the HIV virus. But they're, this is still an ongoing epidemic that we have to face, because a lot of people think that, because of the medication, all this stuff that they have out now, which is a great thing that they do have new medication, because I think in part, I know that in part, that's what saved my life, and that's why I instilled here, because in research and studies and with the upcoming, technology and different things like that, they were able to do things for people today that they couldn't do back then. And so therefore, it's allowing you to save a lot of people's lives, because if not, then they would have a lot more people dying from the virus, and we would have no long-term survivors, and there wouldn't be a need for long-term survivors, day like this. Like I said, it's just been an uphill battle and trying to win this war against HIV and AIDS. I'm also part of the Stigma and HIV Alliance, which is very, very vocal and very adamant about trying to get rid of the stigma that is surrounded. Because I know that in coming up, a lot of people have been going through the stigma. Has got a lot of people, miscommunication, misunderstanding, misinformation, all these type of things, was the cause of stigma. And I think also at that time when HIV was first discovered and first given a name, the media had so much hype about it too. People were paranoid. If they were around you, they wouldn't want to be around you because of the fact that they were scared that they were going to be, catch the virus from you. And they're not understanding the only way that the virus can be transmitted is through, through sex and through blood. But they thought that just being around someone who's HIV positive, then they would get, or if you touch them, then they would get HIV also. So this is a stigma that we've been fighting with for years and years and years, and we're still fighting this war against HIV and AIDS, because of the fact that it's still relevant as it was today, as it was back in the 80s. So for me, now that I'm on, the new regimens and these new medications out, it really helps to enhance my life. Doing what I need to do in order to prolong my life, as far as taking my medication. You have to be sure that you keep a doctor's appointment, because I know that if it wasn't for HIV and AIDS, then I probably would not be here, because of the fact that, I was not worried about, health issues at all, before I was diagnosed with HIV, because I thought that I was invincible, and that, that just couldn't happen. It just couldn't happen until I had to be confronted with it face to face and one-on-one, and realize that, this is something is real. It has no face, name, or anything to it that is associated with, in no respective person. So therefore, it's saying that, anybody that puts themselves at harm, puts themselves at risk for the virus is susceptible to it. And, we're just trying to get the word out and trying to make people understand that, this virus is real, and that it's still going. It's a long time issues with it, and I'm quite sure that they're working, and we've been working a long time trying to find a resolution to this problem here. Now, in the resolution of that, we also now today, because it brings me back to the things that's going on today with the coronavirus, has brought me back to the same type of thing that was going when they had when HIV was first discovered. It was that a lot of misunderstanding about it. People didn't know a lot about it, and and they were just in panic. just like they are now. The difference with this is that the coronavirus is airborne. So therefore, that's why it's asking that if you wear your mask and you wash your hands and you do all things you need to do in order to keep yourself healthy, so that you won't contract the coronavirus. So I mean, it's just something that we have to deal with, and I know a lot of people are all up in arms about this. What am I going to do? I'm scared I'm going to get it. What is my family going to do? And all these questions are up in the air about the virus, even about HIV still. And so we have to stay in the fight, and we have to have educate people properly, and not mislead people into what's really going on, and to accept the fact that this is real. It's no joke, and it has no respect for anybody. So therefore, we have to stay in the fight. We have to consider. And I just want to say thank you all so much for allowing me the opportunity. And hopefully, maybe in my lifespan, we might be able to come up with a cure for HIV, and along with the coronavirus. So I want to thank you all for acknowledging the fact about the racial issues going on right now, because racism has been a problem for all my life. I'm 63 years old, and there's a racism going on, and it seems like it's just escalating more and more and more and more, which is not making sense. And people are losing their lives, unnecessarily because of the color of their skin. So I don't think you should have to walk in fear because of the color of your skin, and especially not when it comes to our law. So hopefully, we can get together, we can do this thing right, and we can become as one and realize that everybody's a human being and everybody deserves to live and everybody deserves to have a chance. Thank you all so much. I appreciate it.
Glenda, thank you so much. We appreciate your courage and your truthfulness and your willingness to share with us today. Thank you so much. And now we're going to hear from Stephen Vargas. Stephen?
Thank you, Barry. It was great hearing Gary and Glenda's stories too. Let's see, my name is Stephen Vargas, folks. I've been living with HIV since about 1995. My journey with HIV actually started before my own diagnosis, though. My mother had HIV, and I began helping her and her husband and his brother. All of them had HIV in the late 80s, early 90s. Excuse me, had some coffee. And in those days, just like Linda mentioned, there was no real HIV medication like we have today. My life with HIV is totally different from what my mother experienced living with HIV. She and her husband and his brother had all passed away by 1995, by August of 1995, which is the month that my mother passed away. That same year, in April of 95, April 19th, as a matter of fact, was when I discovered my own HIV status as positive. I did not share that information with my mother or the rest of my family. I was really fortunate that my entire family, I'm Latino, and when I say my entire family, I mean not just my brothers and their wives, but my cousins, my aunts, my uncles, my grandparents. We all rallied and were there for my mother and our family as we struggled through all of it. It was all of our struggle. So when I discovered my own HIV status in 95, I didn't have the heart to let my family know that our nightmare of dealing with this virus in our family wasn't over. So I didn't share it with them for a whole year, I think, after I discovered my own HIV status. Even though I knew that they would be supportive, even though I knew that many of them were supportive of the LGBT community as well. Although not all of them, but I think a lot of them come around even more now. But I had a lot of support. Even with all that present, I didn't feel I could really lay that on them. Our journey with all this isn't over yet. And so I didn't share it for a while. One thing to remember about those days, my mother was very, very outspoken. And we would go to a support group every Wednesday night here in Houston. I would take her. And sometimes my stepfather would go too. And there's where she met other folks who were even more engaged with HIV advocacy and activism, some people that are part of ACT UP. And she would want to go to some of the rallies and some of the protests And I always would try to discourage her because I was really worried of her being out there. I was concerned for her health. But, you know, she's my mother. She's Latina, and she can be very bossy. And so sometimes, you know, I would lose some of those fights. So I would at least give her a ride. I didn't say, you're going to go. I'm going with you. I'm going to give you a ride. And I gave her a ride. And we participated. And that's how I was introduced to activism back in the late 80s, early 90s. It was because of her. It's not something, growing up, like I said, she was always outspoken. Sometimes my brother Ronald and I would be a little embarrassed when she would get in the middle of someone else's fight, speaking up for other folks. But I realize now that I'm very much the same way. That this apple didn't fall very far from that tree. So when it came to activism, I was not that. I was not that compelled. It was very scary for me. Seeing her do it, I think, was part of my fear, because I kept on thinking that any moment she could get something and get sick, and then she's no longer with us. So that was part of my growing up right there. When she passed away in '95, I already knew about my HIV status at that point. I took a big break from anything having to do with HIV, about a 7-year break. I actually didn't think I would ever come back to do anything with HIV at all. I felt like there was like 5 or 6 years there where it was so intense and so many deaths, not just my uncles and my stepfathers and my mothers, but the people I met through them as well. I had 2 sets of friends even that I lost along the way due to HIV mainly. And so that was another kind of an issue for me. My idea of pulling away was I felt like I was surrounding myself with folks with shorter lifespans, and my life was going to be nothing but loss and grief. And that was part of my pulling away as well. But in 2002, I was at work and I was reading the Science Times, New York Times. Every Tuesday they have a section called the Science Times back then. And in that section, there was an article about the rising rate of HIV in women. And when I read that article, and I shared the story before with other folks, it was really haunting. There was a memory I had that just came right to the fore of being in the basement of the support group in Houston, and our lives were a little switched there. I would accompany my mother, who was HIV positive, as the openly gay son supporting his mother. When we got there, a lot of times there were mothers with their sons, but their story was flipped. The mothers did not have HIV. They were there to support their sons with HIV. It was just the opposite for us. When I would go there, I remember once, she was almost always one of very few women in that support group. I think the maximum amount of women I'd ever seen in that support group in those days was about 3. And that night, when there were 3, my mother leaned over and she just whispered in my ear, "I need home. There's a lot more women out there with HIV. It's going to be really scary when all these women start discovering they have HIV." And we went about that night. Fast forward some 8 years later, and I'm reading this article written in 2002, exactly what was haunting my mother, what my mother was concerned about, just echoed in my head. Oh, there's going to be a lot more women, and here it was coming out in the news. And I got really angry. I was really angry. And I got angry because I kept on thinking to myself, in my head, I kept thinking, we knew this was coming. Why didn't anyone say anything about it? Why hasn't anyone why hasn't anyone done anything about this? And when I looked around the landscape of folks that I knew that were very outspoken, activists in Houston area in those days, there are very few people left. And by 2002, when I was thinking about the names that came to mind, we had address books back then. And I'd go through some of these address books that I had in those days and see how many names are crossed out or names that aren't, and then later realize that they passed away sometime within the last 5 or 7 years. When I looked around about 2002, for the folks that I remember stepping up and doing something about HIV, there weren't that many around anymore. And it really bothered me. And I realized at that point that myself, having experienced some of those days of activism, remembering some of what it was like, some of those early days without medication. Now we're in a time where we have the Line Fight program and a hopper program. We didn't have those things back then. I had to do something I had to do my part. I had to step up and use what I learned to help others. And so I did. And so 2002, I came back and tried to help out. I took some advocacy classes here in Houston. We had Project LEAP, a 17-week training for people who want to be more involved in the planning processes for HIV and the funds that come to our area. I got involved with Latino HIV Task Force. I've since served in the officership with that task force as a secretary, vice chair, and chair of the task force. Became part of the Ron Hyde Planning Council. I again chaired that council for several years. I am still part of that council today. I think I'm in my third 6-year term, my first of the 2 years, 3 years right now. And also at the national level, took some advocacy classes with the Latino Commission on AIDS. So really helpful and instrumental in helping me understand Latinos and HIV issues. And so through that one, be more involved with advocacy too. One of the things my mother, when I would say that I was an activist, and sometimes we'd introduce ourselves, and I would say something like, "Yes, we're both HIV advocates." When we were alone in the car, she would just look at me sideways and just joke that, and just going back to something that Gary said, that yeah, activist, you've never been arrested, and it's true. I've never been arrested. Still today, have not. In my mom's eyes, unless you've been arrested for something like this, you're really not an activist. So truly, I guess in her eyes, it may not still be an activist. I still consider myself an advocate. And so the trajectory that I've seen since learning about HIV in 1983, being affected directly by it by 1989, 90 in my own family, the days before we had meds, the days before we had programs to help people living with HIV, the Ryan Fight program, like the Hopper program, we've seen a lot of changes. The complexity of medications and the dosing of medications has changed too. The effectiveness of the medications has changed too. My mother, can't even see how anybody with HIV in those days ever got a good night's rest. My mother had to get up every 4 to 6 hours just to take a set of pills. Some of them with food, some of them without food. So without food, she could get a full 6 hours sleep, which still isn't really enough. But because of the pills she had to take without food, really she only got about 4 hours sleep to stretch at a time. And so I could not imagine how it is, how could we be expected to survive if we can't even have the medications that are supposed to help us, let us get a good night's rest. And that's beyond even dealing with all the side effects that people had to deal with back in those days. So that's a little bit of my trajectory right there. The Planning Council information, sharing it and all, I think people should be more involved. Advocacy doesn't happen just on themselves, planning. I've been involved with Texas HIV Advocacy Days here in Houston almost since they started, and AIDS Watch at the national level. I think that's it, Barry. I don't think I have anything else.
Well, that was great, Stephen. Thank you so much. And again, as with the other panelists, thank you for your willingness to open up and share with actually strangers your story. So thank you so much for doing that. We're now going to switch to a few questions that we have for the panelists, and each person is willing to answer. If you have something about this question you want to say, we want you to do that, but if you don't feel obligated. Okay, so I'm gonna start with how has HIV treatment changed, and how has that impacted you over these many years? Any one of the panelists want to answer that? Stephen, you want to start?
Yeah, I think I alluded to it. It's changed dramatically, folks. It really has. I often share, like I did a few minutes ago, that my mother's life with HIV is totally different than mine. I shared a little bit how she had to wake up and everything else. Sometimes it was even, let's see, when I think about what she had to go through taking the meds and being adherent to medications, and I hear people talk about people need to be adherent with medications, it was really complex back then. Today, my HIV regimen consists of this. I wake up, I take a pill, and that's it for the day. With this pill, I don't necessarily have to have food. I can have food or not. It doesn't matter. It's not necessary. It's that easy. And back in those days, it was not so easy.
Right. Thank you, Stephen. Glenda, is there anything you want to respond to the question, or would you want me to go on to Gary?
No, sure, I have no problem with that. Because as I said earlier, when I first was diagnosed back in 1992, the only medication that was available for people that were diagnosed with HIV was on AZT at that time. And in years coming back, they realized that medication was too toxic for some people's immune system, so they had to change it up. But I'm absolutely, totally thankful and grateful today that there are so many different medications, and then you don't have to take all the pills like you used to take back in the day. You know, I mean, you have 3 pills in one, so that way you don't only have to worry about taking 1 pill a day. You know, which is a great stretch from 1980s and 1990s when they only had 1 pill, and it had, you know, you have to take 2, 3, 4, 5 different pills a day, and that's what was a deterrent for a lot of people in keeping their treatment and their regimen going, because they looked at those and they got, you know, discouraged by the amount of medication that they had to take. So I'm so grateful and so blessed today that they have the different medications and that you don't have to take as many pills as you did back in those days. Thank you so
Great.
much.
Thank you, Glenda. Gary, do you have any response you want to offer?
Yes. The remarks that Glenda and Stephen made about the early days with AZT brought back some powerful memories as they were talking. I did AZT around the clock for 5 years. At the time I started it, friends that were a lot smarter than I said, "Oh, why are you doing that? We don't know the long-term effects." And I said, "Well, what long-term? You know, we've got to do something." So I'm glad I did it.
Exactly.
I was able to tolerate it. I waited to die every day for 10 years. I mean, the protease inhibitors and the drug cocktail stabilized my health and gave me a whole new outlook. For me, that happened, I think, around 1993, 94. The surprising thing I will add that we learned with the new meds is that our immune system could recover, that our T cells could go up and not just maintain what was not already depleted, which is what we thought we were going to be limited to. So now I'm very grateful to be living a normal life. That's how treatment change has impacted me.
Thank you, Gary. This next question is a little bit about the care system, and that is from your perspective. What supports and needs do long-term survivors need from the care system?
This is Stephen again in Houston.
Stephen, go ahead.
Yeah, I think that's a really complex issue because it isn't a simple one answer. I think it's a tiered answer for the most part. When we think about folks that are long-term survivors, first of all, before I go down that road, I also want to share this, that when we think about HIV long-term survivors, we have folks that are on this panel. We're all, I'm assuming we're all at least 50 years old or older, myself included. But we also have to remember that when we talk about HIV long-term survivors, there were children born in 1995 with HIV who are still with us, who are going to be celebrating their 25th birthday. They are also HIV long-term survivors and half my age, more than half my age. And so I just want to put that out there so that we're aware of it. So, but I want to say, because what I'm about to say now is more directed towards folks who are older like myself, that we need more research into how HIV is affecting us as we age, the regular aging process, the HIV process, and how are they working or not working together. We need more research along those lines. What folks stand to learn from us, this this vanguard generation of people who are actually living longer than we thought we would be living with HIV, learn from us, benefit those young folks who are 25, turning 25 this year, and anyone diagnosed. So that's one thing. More research. We need to see what we can do, even though it seems a little pie in the sky these days, and more unrealistic, is the importance of aging in place. A lot of folks about my age who are part of the LGBT community, I can't overstate the importance of being able to age in an area, a neighborhood, a city where you felt most at home, most welcome, had most of your memories with your friends that you have or have had. It's really important, that sense of place. I think it's going to be a hard one to do, though, given gentrification and rising poverty rates. But with or without agent in place, support, companionship, offsetting the sense of isolation, those are going to be necessary as well. So even if you can't age in place, I think an investment needs to happen within housing programs for folks with HIV, folks who are part of the LGBT community, where you can still have that sense of community, even if you have to leave someplace where you felt most at home. So those are some things I think are necessary, some research, facilitating aging in place, or provide that support and companionship services that people need.
Thank you, Stephen. Glenda, do you have any response to the question?
I think Stephen said a mouthful, because the fact is, the medications, they're coming out with new medications every day. And so all you just have to face the understanding and belief that, look at the long-term survivors like myself and Stephen and, other long-term survivors, is that you can live a normal, somewhat normal, healthy, productive life and, with HIV. It doesn't have to be a death sentence like it was back in the 80s and 90s, where people were just dropping like flies. You couldn't understand why they were. So I applaud the fact that pharmaceutical rep and the testing that they're taking right now give people like myself an opportunity to still be here today as a long-term survivor.
Thank you, Glenda. Gary?
Yes. It was just 2-3 years ago that our local AIDS services of Austin recognized that as of that point, more than half of their clients were 50 years old or older. And that brought to the fore that attention needs to be paid to the special needs of older patients. We know that, that anybody who's gay knows about ageism in the gay community, the LGBT community. That saying was, Grindr sends you a death certificate when you turn 40. So there's that. And just general ageism in the community. This leads to social isolation, especially considering that a great many, much higher percentage of gay LGBT people than straight people are living alone as they age. So there's that. I agree certainly with Stephen, the importance of enabling aging in place, and we need more services to allow that. One of the things that we need to be very cognizant of is the need to train healthcare, home health workers, et cetera, nurses, to be respectful of gay people, to dispel whatever discrimination they may be inclined to express. And this is true in spades for living in an assisted living or nursing institution, to make sure that our gay community does not face discrimination or abuse because of their sexual orientation. We know of so many stories of gay men going into nursing homes who tell us they had to go back into the closet. How frustrating and lonely that is. So,
thank you, Gary.
Mm-hmm.
My next question is, what would you share with somebody newly diagnosed today?
I would like to answer that.
Glenda, go ahead.
I think, first of all, we have to give them hope, encouragement, and empower themselves to know that this is not a death sentence. If you are newly diagnosed, then, there's regimens out there, there's treatments out there, there's medication out there that you can take that can help prolong your life, whereas you can, as a newly diagnosed, yourself can become a long-term survivor. So don't give up, please stay in the fight and continue to do everything you can to keep yourself healthy and, somewhat normal life. Even though the diagnosis may be new, you might be new to the diagnosis, and you may be upset and, all the emotions that you go through in finding out about a new diagnosis. Just know at the end of the day that there is hope.
Thank you, Glenda. Gary, do you have anything?
Go ahead, Gary.
Go ahead, Stephen.
Okay.
Me? Okay.
Oh, I was.
Well,
No, go ahead, Gary.
all right. I certainly concur with what Glenda said. She said just about everything I had written down. It's important to be an advocate for your own medical needs. You have to be a good consumer of medical services. And that's not something that most of us grew up doing, but you have to speak out for yourself. It's also a responsibility that you're going to have to be compliant with the medical protocols. You have to take your meds, and you have to do the follow-up testing and visiting with the doctors. I know a lot of guys who just wanted to put it out of their minds, ignore it. You can't live that way. I think it's very helpful, as I've already made clear from my own comments, that it's important to be an advocate for other people with HIV. You'll find your courage in dealing with the issue if you help others. And also to seek out partners who are knowledgeable about how the virus is transmitted, that are not fearful of you. We know that if you're in treatment and the virus is suppressed, that you are not contagious. But if you've been on a social platform lately online, there's an awful lot of ignorance still out there. And that's something that can only be helped by further education. But, just don't let it get you down, is what I would say. And that's all.
Thank you, Gary. Stephen?
Yeah, let's see. The only thing I have to add, echoing what they said, but the only thing I have to add is, I've had a variety of experience with HIV, not just living with it. I worked in the HIV field as a case manager, as a program coordinator, and still we hear today from people that are newly diagnosed, their ideas, their perceptions of HIV many times can be what our perceptions were in the 80s. Sometimes thinking it's still a death sentence. So like Glenda said, about letting them know that it is no longer that there are ways to live long, healthy lives. Getting into care as soon as you can, I think is important. Availing yourself to the services that stay in care, making folks aware of those is important. Complain. Don't be afraid of complaining when things are not working the way they were explained to you. If that's the case, certainly complain. Particularly if you have an idea of what could have made it easier for you, share that for sure. That is exactly the systems we have today. We have to remember people fought to have these systems in place. Because the federal government, as Gary mentioned earlier, was doing nothing. And so we have to fight. And from that fight, we ended up with this program called the Wi-Fi program, the Hopper program. We need to access these services if they're available to us in our communities to make sure we can get into the care we need. And then help with improvement.
Thank you, Stephen. Other question is, and you've talked a little bit about this, but I wanted to home in on this a little bit more, is what have you learned or what skills have you developed to help you survive with HIV?
In the early days, when we didn't have medications, there's a lot of history here. In the early days when we didn't have medications, the person with HIV, what we tried to do was try to maintain our good health for as long as possible. So if you were not already a person that was exercising on a daily basis and eating more healthily, a lot of times you started making that switch towards those changes. Because my mother had HIV before I was diagnosed, and recommendations were made to her for making those healthier habits, those changes, I incorporated some of those changes myself before I was diagnosed with HIV. They're kind of in place by the time I was already diagnosed with HIV. The reason that was important was because back in those days, it was a rite of passage, almost like a rite of passage for us, that there would be a time when you would end up talking to your doctor, and the doctor would say, I think it's time to start talking about starting some meds. Your T cells would be around 500 or so when they would have that conversation with you. Treatment today is so different. We know that once you find out you have HIV, they want to start you on meds almost as soon as possible. Back then, they wanted to wait until your T cells got to about 500, sometimes even 300 in some cases. Scary to think about today, right? But that's what we did back then. And so before you got to that point, as a person with HIV, you did everything you could to maintain your health in good standing, anything you could do.
Thank you. Glenda, do you have any comments on the question?
Well, the only thing I can say about that is that, I try to make people understand and to educate them to be able to advocate for themselves so that they can have a better life and that they can have, medication. And if they have any questions and concerns about their medication or about, their treatment and everything like that, please do not be afraid to ask questions, because I've seen so many times where people just, give them medication. They don't know what it's for. They go to the doctor, just scared to ask the doctor, why, are you giving me this medication? Or even going to the case managers, and the case managers, help them navigate through the situation that they're going through, especially being newly diagnosed. And to understand that, there is hope, as I said, and I will say it to the end, there is hope. All you do is have to face and keep hanging in there and stay in the fight and stay in the struggle. Don't give up on your life or yourself. Thank you.
Thank you, Glenda. Gary, you have any response to the question?
Would you repeat the question?
Yeah. It's about you. What have you learned, or what skills have you developed to help you survive with HIV?
Oh, well, I guess I will be repeating myself. You learn to live with fear and to manage that, and you learn to live with stigma. We've talked about that. And it's still true. We've talked about that. One thing that I find so hopeful about what we're looking at right now is how the AIDS service agencies are turning to a complete medical services model. This has been happening in Austin. I assume it's happening elsewhere. And I think that's going to make it a much more manageable situation for new patients and certainly for those of us who have had it for a long time, that we'll be able to go to the agency for all of our needs, whether that involves social workers or the medical field or pharmaceuticals. I've had a friend call me in a panic from Walgreens saying the doctor didn't approve renewal of my prescription, and what do I do? And then it took a week to get the doctor to sign the form. That kind of thing we're going to get rid of now. We're not going to have to necessarily, at least in the urban areas, not have to put up with bad medical management.
Thank you, Gary. I think we're at the point for any, we're going to turn to any questions that the audience has. You can submit that in chat if you have any questions. And so I think Catherine and Jesse are going to be relaying those questions to us.
Hey, thanks, Barry. And I want to just take a minute to thank all of our panelists for sharing. I know that a lot of people have typed into the chat to thank you all for stepping up and sharing your stories and your history and those parts of yourselves so publicly with everyone here in Texas. So the first question that came in was, for those who continue to advocate for policy and systematic change, what is one piece of advice or encouragement that you would share to those people who are continuing to advocate?
Stephen,
This is Stephen.
I'll be at the top here, so I'll call on Stephen first then. Go ahead.
And so, I am still continuing to advocate, and I thank you for asking the question and continuing to advocate yourself. The first thing I keep on thinking, there's really two things I think is take care of yourself. That's one thing. This is a long haul change when we talk about changing systems. So the first thing is making sure you take care of yourself, get the rest you need, pull away when you need, and so on. Be mindful of that when you need to take a little break. That's the first thing. Second is develop those allies, cultivate allies. If we look at the work that we've been doing, either with the LGBT community, with the HIV community, with any community, the African American community, it's our allies. When we start reaching beyond ourselves and start educating others about the plight that we're experiencing, that can change people's minds and get them. That's what we need. We need not just ourselves speaking up about our own issues, but convincing others of the willingness to step up and help us change. And so, developing allies and take care of yourself.
Thank you, Stephen. Glenda, do you have any response to the question?
Well, actually, the other thing I can say is that, you have to be vigilant. You have to stay in the fight. And, I mean, don't live in fear. A lot of times, fear can stifle your growth. So therefore, just continue holding on regardless what the circumstances are. Get you a support group. Rally around people that are going to be supportive to you, because at a time like that, when you're newly diagnosed, you definitely need a lot of support. And a lot of people are not disclosing their status because of the fact that they're afraid of, not getting any support from anybody that they really care about. Especially, if somebody that you love, and you dispose it to them, and then they just walk away from you and you never see them again. That's devastating. So, like I said, regardless of what the situation or circumstance comes, just stay in there, hang in there, take care of yourself, and love yourself enough to, do what you need to do to stay healthy and to stay alive.
Thank you, Glenda. Gary?
Well, I would just add, I guess, a different angle. It's how important it is to speak your truth. I am totally okay with people only doing that in their immediate circle. I found it very helpful, very useful to speak out about my experience publicly. That is what seems to get people to pay attention and to want to be a part of the solution. We need to be aware, if we're currently advocating on the issue, how fragile the funding is, because so much of it is coming from the government. And as we've seen in the last 4 years, the government can turn on its head, and we can lose all the support that we've had. So it's important to consider the need to be involved in making sure there is funding for your AIDS services locally. When we first moved back to Austin and decided that we would be willing to get involved with the AIDS agency, the first thing we said was, well, just don't ask us to raise money. We're not going to stoop to doing that. And of course, it wasn't very long before I was the chair of the development committee having to do that. Because that's what's needed. It's what's needed in nearly every nonprofit, is to find the money to get the work to go on. So please consider that.
Thank you, Gary. Jesse?
Hey, thank you all. So another question that's come in. What are your thoughts and feelings knowing that younger people continue to be diagnosed with HIV, and when they receive their diagnosis, they explain that they didn't realize that HIV is still an issue?
Well, I'm concerned about that question there is, yeah.
Well, go ahead, Glenda. Glenda, go ahead.
Okay, my concern about that is because it's frightening because, first of all, the younger crowd, they feel like they're invincible, okay? And this is not something that they will ever have to deal with. But unfortunately, in today's society, we do have to deal with that on a daily basis. And to let them know that, look, because to my dismay, I was surprised to find out that there were actually some young folks that were out there deliberately, trying to acquire HIV. And I couldn't understand that for the life of me. And, it's because I don't want, that means I don't have to work. That means I get, disability or whatever, and I don't have to work to do anything. But I mean, you're not looking at the other side of it. Think about all the other things that goes along with that, as far as your health is concerned, being young, and, what would that take away from your life? So, I mean, I'm just saying, look, just understand and know that this is something that's not a joke, and it's not something that you want to deal with for the rest of your life. There's a lot of people I know people that are 24 years old now, and they've been dealing with the virus for 24 years because they were born with it. So, I mean, you know, and the young people need to understand that this is something that could happen to them. So I just want them to be aware of that.
Thank you, Glenda. Gary, do you want to go next?
Well, this is a question that has always stumped me. During the period of my affiliation with AIDS Services of Austin, we were constantly measuring, you know, the number of outreach contacts that we had made to educate, constantly raising, you know, putting more and more money into it. And yet that level of disbelief among young people we just never seem to make a dent in it. And I certainly have no answers for that.
Thank you. David?
Yeah, one thing I keep on thinking is that as long-term survivors ourselves, older folks, or people who experience the early days of HIV, we have to remember that our experiences, our stories, are not their experiences and are not their story. And so I think sometimes when we as older folks try to share and teach folks, we do it from our own experiences like that. And we really have to hear more from them, their experiences, what they're learning, and so on. Their stories can be very different from ours. That's one right there. So sometimes I do see it as our own failure. And I don't mean our failure as people themselves, but a failure of society. If we don't have a comprehensively approved sex education courses in Texas, in my mind, that means we are all at risk, no matter how old we are, for acquiring HIV. So that's a societal, that's a system thing that we need to look at. And so that's why I also say it's part of our own failure when these things happen. Don't to mention folks, young folks who might be deliberately trying to acquire HIV. When I hear that, the first thing that pops in my mind is this is how desperate people are to get the support they need that is currently lacking from all of our systems, whether it's the educational system, the medical care, that you will do what you can to where you see the support is given, where you see you can get the most help, particularly if you're not having any help with education, employment, or health access. And so it's as horrible as it sounds, you kind of understand, move in that direction where you can probably get a little bit more support for what is it you think you want to do. And I think it's a mistake to acquire HIV, particularly if you're a young person. When I think about young people, when I think about when I was young, hooking up was a very big thing. And so the idea of if you think it's going to be easier to hook up when you have HIV, you have another thing coming. And so that's something that people can be aware of. And that's a message I would share with young folks that, you know, if you like dating and everything and you think it's hard now, it's going to be even harder if you have HIV. That's one thing. So there's just three things right there. Remember that our story is not their story. Remember that our systems are not in place right now that can really, truly support people, and it can cause people to make some desperate actions.
Thank you. Jesse?
Those were the, wait, so we've got one more?
Okay.
So someone just chatted, something that we're grappling with at the moment of Black Lives Matter and coming to terms with the injustices and systemic issues we face is what is our role as health service providers? How do you think we can bridge the gap given our history of activism and now that many community-based organizations have shifted into medical home models? So I do think that's an interesting question about, you know, what do you see as the role of HIV service organizations, which have for a long time and have deep roots in social activism around HIV, as social justice organizations, and how the lessons learned from, you know, early days of HIV activism can translate and support current activism.
Any thought from the panelists on that?
Yeah, if no one else picking up, Stephen. One of the things I think it's really, I think we need to start promoting more is just to demonstrate the difference, essentially. When we look at the outcomes of people living with HIV who use their private health insurance as opposed to the folks who use the Ryan White program, When you look at outcomes of folks that are able to get viral suppression, we see much better outcomes for folks that are using the Ryan White program in reaching viral suppression, maintaining care, and staying there, than as opposed to folks who are using their private health insurance. That's key, because one of the things we can highlight there is the importance of support services. The Ryan White program doesn't just provide the medical care and help you get access to your medications. It provides support with transportation, with child care, mental health services, substance use services, and on and on and on. Whatever it's going to take to help you stay in care and capitalize on the care that we have today. When you go to a private doctor and you can't get there because your car's broken down, you have money for the bus, that's not their issue. They're not going to say, we'll call you a cab or something like that. So the reason I think it's important for us to highlight that is because it's necessary for us to highlight what it truly takes to help people get into care and stay in care. That this is a model that demonstrates through data what is necessary in order to help us get to a point where we can truly end this epidemic. I think it's important to highlight that, because what that program does, it offsets some of the more inequitable situations that most people in our state and our country experience when they try to access healthcare. And so that alone, I think, is what we need to be pushing more, highlighting more. In other words, to try to convince others why it's necessary to have something more like a national healthcare system or something similar to it that has access to support services.
Thank you. Glenda or Gary, do you have anything you want to add?
I think also we need to look at the fact of, testing is a priority, number one. So we need to do outreach. Because I work for I'm with an ASO agency, and they do outreach, we do testing, they do education, because without being educated, then you don't understand the whole dynamics of it anyway. So we do the education, the testing, and the resources to allow you to access all the resources that we need in order for us, to keep healthy. So I would say, to the young crowd, just make sure, that you are out there and you're willing to get tested, and we need to do in order to get these people, under control. Because like I said, the youngsters are really actually thinking that, this is something that is not real. Oh, well, like they did back in the day, it's not treatable. So it's not curable, I'm sorry, but it is treatable. But the thing about it is, they feel that, it's something like an STD or something like that. I can just take a shot or take a pill and it will be done. And they have to understand, the dynamic that this is not something that they have to treat for. And it's not going to go away by taking a pill or getting a shot 2 or 3 days from now. So we need to make that understood. And also, like I said, the ASOs need to continue, doing research, doing the testing, doing outreach, whatever it takes to reach the people that you need to reach in order to put this thing to a close.
Thank you, Glenda. Gary, do you have anything you want to add?
Well, not really. They both made very important points. And in listening to them make those points, it drove home to me how important it is that AIDS service agencies are moving into this complete medical and pharmaceutical model. One of the ways that Austin's ASO was able to reach people who were outside, these circles of communication was by having caseworkers who were out in the community, not just sitting at their desk waiting for people to call and ask for help, but
exactly.
getting out in the alleys and doing the work in the street. I always, on the face of it, that sounds like it would be more effective, and I'm hearing approval from Glenda, so I guess it was a good approach.
On my head.
Well, because, if you don't go to them, they're not going to come to you. So then somebody has to fix the file and has the courage to say, okay, well, we're going to go out there, to the byways and the bridges and, to the flop houses and all these places where we think, where it is critical and where it is very viable that it could be transmitted. So therefore, we can't be afraid of doing that.
Right. Thank you. We're at the point where at our any final thoughts or comments from the panel. And then we're close to our 12:30. We're getting close to that. So just wanted, you don't have to offer anything, but just wanted, after you spent almost 90 minutes together and with the audience, to see if there's any final thoughts or comments. Stephen, you want to go first?
Sure. Let's see. I think it's, before we get off this call, I think it's really important for everyone working in the public health field to work at drawing those links between the fights we're having today when it comes to police brutality and unnecessary deaths to public health inequities. The roots of the public health inequities and police violence and people being killed are the same. We know it's based in racism and systems that were both ideas. And so dismantling that system, fixing that system, tweaking that system in whatever ways we can to remove those aspects of it in every way we can is what's necessary. We have to draw those links more clearly so the public can see that protest is an act of courage and commitment towards eradicating racism. And it'll also help us with creating a more equitable public health access system.
Thank you, Stephen. Glenda, any final thoughts or comments?
Okay, the only thing I'd like to say is that this epidemic is not a me thing, it's a we thing. Because everybody somewhere is either infected. If you're not infected, you're affected. So we all play a role in it some kind of way. So we must be, like I said, we must be viable, we must be intending to go out there, and keep in the fight and make sure that, that everybody's taken care of. Like they should be.
Thank you, Glenda. Gary, any final thoughts or comments?
I would just add personally that how grateful I am that there are all of you health workers out there willing to take on a vocation that is not going to make you rich, but that has a great deal of meaning in life to offer you. Gratitude is my final point.
Great, thank you. I want to add, before I turn it back to Jesse and Catherine, I want to add my appreciation and thanks to Stephen, to Linda, to Gary. I think it's been a powerful hour or so that we have been together. I appreciate your honesty, your candor, your sharing your personal life with us. I think we're better off because of that. Thank you for doing that. And I appreciate the journeys you've each taken, which is different, and appreciate that you are a long-term survivor. With that, I'll turn it back to Jesse and Catherine to see if there's anything else they want to say. And also, I want to thank also DSHS and Achieving Together and the syndicate for their willingness to host this and this event today. Thank you.
Great, thank you, Barry and Stephen.
Thank you, Barry.
Barry, and for stepping up and sharing your histories and stories and speaking so candidly with us today. And thank you to everyone who joined us today. I think it was a great session. And thank you for everyone who asked questions. And I think that's it. Catherine, do you have any last thoughts before we sign off?
No, I just want to thank all of our participants for their time today and for sharing their stories and their experiences with us.
All right, before we go, I just want to remind everyone that if you aren't following Achieving Together, I highly encourage you to go to the website and start following the work that's happening around Achieving Together and ending HIV in Texas. Again, that's achievingtogethertx.org. And after, Catherine's put it in the chat. Thanks, Catherine. And if you have any questions or anything or thoughts or want to share experiences after the webinar, feel free to go to the website and you can email us at joinus@achievingtogethertx.org. With that, we're going to sign off. Thank you, everyone, for your time and for participating today. And Stay safe, and I hope you have a great day and a great weekend. Bye,
Thank
everyone.
you.
Yes, thanks.
Y'all
Thank you all
too.
guys so much too. Thank you all for the opportunity.